Hello, friends and family. Are you this one person who is so scared of going to the dentist that, you just like postponing your appointments? Well, you're not alone. You're not alone. Trust me, you're not alone. There's so many people who are very, very anxious of going to the dentist. But how is that behavior affecting you? Today, I want to talk about how anxiety is robbing you as far as your oral health is concerned. Okay, I'm Dr. Valerie. I'm the founder and owner of Healing Wings Dental, the place where we help our patients maintain and or regain their oral health and smile so that they can soar in life. So yes, today we're going to talk about how anxiety is robbing you. Okay, it's robbing you of your health. It's robbing you, of you being just like a healthy person. And so what I want to talk about is number one, the fact that you are postponing your appointment is creating a whole lot of problems for you, because many times, with our health, it's funny, you don't really see or you don't really feel how things are progressing to your detriment. You don't really see it, you don't really feel it, because when you have a cavity, for instance, initially the initial stage, it's not hurting you. You don't feel it, you can perceive it, you don't even see it sometimes, right? But it's growing and growing and growing, and the cavity keeps on progressing. With some people are more sensitive than others. So with some people, while the cavity is progressing, if it actually gets to the space that is right under your enamel, which is the outside surface of the tooth, it's called dentin, then if that surface is exposed, it start being very painful. That's my case. My teeth are very sensitive. I remember one time I had when I was undergoing my orthodontic treatment, or I had braces, and one of the brackets actually came off, and it actually took away part of my enamel, so my dentin was exposed, and I was in excruciating pain. I thought, that maybe I would need something as deep as a root canal, but it was just that the dentin was exposed. So with some people, it's going to come with pain, and then pain is going to signal that, oh, something is wrong, and so I need to go and get it checked. But many people, however, dental problem would actually go through or grow, and they won't even know about it. They will be oblivious to that fact, right? All the way up until maybe, it reaches the nerve. And then again, it depends on how fast things actually reach your nerve. Because if it goes really, really fast, then you're actually going to, feel the pain. But sometimes it goes so slow and steady that you don't even feel anything. And so you start having, other problem like infections and all of that. But then why I say that it's robbing you? Because it's robbing you of your health. So now a tooth that could have maybe like been maintained, or a tooth that could have been restored, all of a sudden now you get to a place where maybe that tooth needs to now be removed, right, or extracted. There was a patient that came into our office yesterday, in fact, and we saw the patient about 6 months prior, right? But then the patient comes in, and even with a referral, thank you for the referral, and now the tooth is to the point where it needs to be removed, right? Because the cavity has traveled all the way to the nerve now. So 6 months prior, person needed a filling, person didn't come, and then now after 6 months, it's an extraction. And that person is not the only one. This happened. We see that all the time. You can ask your dentist. We see that all the time. I mean, usually the progression is not, as fast as that. But there are some cases, like if, in fact, if the cavity does not progress really fast, you're one of the lucky people, as I can say, right? But like sometimes it goes so fast. So now you have robbed you of the opportunity of keeping that tooth. So now you are needing to now having that tooth extracted, or if the tooth is not to the point where it needs to be extracted, you may end up needing a root canal with a crown. You can only imagine that the cost would skyrocket. Between the difference between a simple filling and now needing a root canal plus a buildup plus a crown, or an extraction, and then the tooth being needing to be replaced with an implant or with a bridge or something, it ends up, robbing you, right? Okay, another thing how, your anxiety can rob you is, say, for example, you don't come because you're so scared, of the noise or all of that, and you don't come to the dentist, so you avoid it. You avoid it, and so all of a sudden, you end up developing gum disease, right? Gum disease where, I mean, if you're lucky, it has only affected the gum. We do the cleaning, about 2 weeks after, you're back in business. But then if it goes all the way to periodontal disease that has affected your bone, now you have additional problem. If it has actually progressed so much, it can actually end up leading to mobility of your teeth, or you even losing some teeth on which you don't even have any cavities, right? So it's robbing you because you can end up losing teeth. And even with that, say for example, you now, have lost teeth because of mobility, you now have to replace those teeth. So that is robbing you as well. So what do we advise you to do? Try to face your fears, right? Just like if you're a parent and you have a child that's really scared and you want to advise them to face their fear and you want to be there for them. So something that you can do is, instead of you coming on your appointment on your own, why don't you bring like a trusted friend, somebody that can actually support you and be there to give you comfort. I remember there's this one patient that came into our office, this lady, and she came in with her husband, and her husband was like holding her hand. That decreases the level of anxiety, allowing you to face, the issue, right? So you can also bring in like a set of earphones. If, for example, you're anxious because you don't like the noise, and you're there for treatment, you can bring a set of headphones, and then you can listen to your favorite music. In our office, for example, we have TVs, on the ceiling. So when the patient is laid back, they can actually watch their favorite movie. And we encourage them, to increase the volume so that they can hear, because that's going to distract them so that they shift their attention to something else. Maybe the show that they're watching, maybe like something comic, or they can even listen to music, say on YouTube, or, if they brought their own music, they can do that as well. That is going to help you. So there are techniques, there are things that you can do to actually alleviate your level of anxiety. But what you don't want to do is trying to avoid the dentist by all means, because doing that is going to just exacerbate problems that you can have, that you can end up having, or that you do already have. But when you come on a regular basis, we are actually able to keep things in check for you, do your cleaning, so nothing actually ends up, getting to such a point that now you're having some other type of issues. It's kind of like cancer, right? The earlier you catch it, if it's at stage 1, something can be done about it. But when it's at stage 4, you see that, it becomes a whole different story. Okay. So yeah, so your anxiety is real. You're not the only one, so be encouraged. But there's some things that you can actually do about it. But the worst case scenario is actually staying home, avoiding situation, because there will come a point where that tooth will say, hey, I'm the boss. Now all of a sudden, you have excruciating pain. You did not sleep at night. You now have to miss work. You now have to miss school, and, a whole lot of problem, including financial problems, right? So do come for a routine checkup. Try to face your fear. And what actually happens too is that I've seen it time and time and time again with many patients. We have so many of them, children and adults, who would initially be very, very anxious, but over the course of time, now they stroll down the office on their own, and they're like, hey, I'm here, for my checkup. So the more you face it, the more you realize, what? It's not that bad, you can regain confidence. And In our office too, what we want to do, say you came on your own, we always have like somebody that we try to, if you're very scared, you don't know what to expect, while we're doing treatment, we try to have one of the assistants, come and hold your hand to kind of like support you, because that goes a long way, right? Human touch oftentimes goes a long way. So yeah, that's what I wanted to talk to you about. Don't rob yourself of having a great oral health, because that can only just affect you in a bad way, in a negative way, right? You can end up having mobile teeth, you can end up losing teeth, you can end up having infections, you can end up having bad breath, and that goes a long way. That can affect you negatively, even in your job, even in your relationships, and all of that. And we don't want that to happen to you. So try to face your fear, okay? We are Healing Wings. I'm Dr. Valerie Mukanga once again. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. Our phone number is 972-213-0202. And we just want to invite you, if you don't have a dentist that you usually go to, or if you've had a negative experience with your dentist, we do invite you to come over, come try us out, check out our Google review on our Google page, Healing Wings Dental, and you'll see that many people say they had been anxious in the past, and now, we made them feel comfortable. Just go check it out for yourself. If you like this episode, if you like what you heard, please share it with your friends and family. Subscribe to our YouTube channel, Dr. Valerie Mukanga. Subscribe to our social media handles on Facebook or Instagram, right, at Dr. Valerie Mukanga or Healing Wings Dental, and we'll be there to help you, provide you with information that can harm you so that you know how to take care of your oral health. All right, that being said, you have a great day and be blessed. Make your day positive. It is within your power to do so. And see you next time. Bye-bye.